All right, let's dive right in. Today we're talking about your body's own internal cleanup crew. It's this incredible, kind of unsung system that handles everything we put into our bodies. So let's get into the fascinating world of phase 2 metabolism.
I mean, have you ever really thought about it? You take an aspirin, your headache disappears. And then what? Where does that medicine actually go? It doesn't just, evaporate. Your body has this super sophisticated process for basically showing it the door. And once you understand it, you'll see how medicines work and why, sometimes, they go wrong.
So here's the fundamental problem your body has to solve. It's kind of like trying to wash a greasy pan with just cold water. It doesn't work very well, right? Well, most drugs are what we call lipophilic, which is just a fancy way of saying they're fat-soluble or oily. That's great for helping them get into your cells to do what they need to do, but it's terrible for getting them out because your kidneys run on water. So how does the body fix this?
Well, if those oily drugs just stuck around, they'd pile up in your fatty tissues, and that could become toxic fast. So the body's brilliant solution is something called biotransformation. It sounds complicated, but it's really just a chemical makeover. The body literally changes the drug's molecular structure to get it ready for disposal. And this makeover usually happens in 2 steps. First, you've got phase 1. Think of this as the prep station. It makes a few little chemical changes to the drug, basically adding a handle so the next step has something to grab onto. But the real heavy lifting, the part that seals the deal, is phase 2, and that is what we're focusing on today, that crucial final step called conjugation. So what exactly is phase 2? This is where the body takes that prepped drug molecule and sticks a big water-loving molecule onto it. The best analogy is shipping a package. Phase 1 is like writing the address on the box. But phase 2, that's when you slap on a giant bright orange ready-to-ship sticker. This sticker makes the whole thing so water-soluble that your kidneys can just grab it and toss it out.
Now, the body has a few different kinds of these shipping stickers it can use. But there's one that is by far the most common, the most versatile, really the most important one of them all. So let's meet the body's #1 shipping company, Glucuronidation.
Okay, so what you're seeing here is a look inside the body's detoxification toolkit. You can see a few different options, but the undisputed star of the show is glucuronidation. This process basically grabs a sugar-like molecule and sticks it right onto the drug. And because it's so common, it's found in pretty much every tissue in your body, it's the absolute go-to method for dealing with a huge range of chemicals.
And this is not just some abstract science lesson. How well your personal glucuronidation pathway works can literally determine if a drug helps you or harms you. It's this incredibly delicate dance, and it's something drug companies spend a fortune trying to get right. Let's look at what that means in the real world.
So on one hand, you have a success story like ezetimibe. It's a cholesterol drug, and its entire effectiveness and safety really depend on this glucuronidation process. The body uses this pathway perfectly to manage the drug, keeping it in that sweet spot where it's working but not building up to dangerous levels. It's a beautiful partnership between a man-made drug and the body's natural systems.
But sometimes that partnership goes really, really wrong. This quote here tells a very different story. MK-8666 was a drug being developed for type 2 diabetes. It looked promising, but then it started causing liver damage. And guess what the problem was? The glucuronidation process itself was accidentally creating a new toxic molecule that attacked the liver. It's a huge reminder that even our body's safety nets can have unexpected glitches.
Glucuronidation is definitely the main highway for getting stuff out of the body. But there are other tools in the kit too. You can think of them as specialized cleanup crews for very specific kinds of jobs. Let's meet a few of these other players.
First up, we have sulfation. Now, don't worry about all the chemical jargon here. The main thing to know is that this pathway is a specialist. It's really good at handling certain types of molecules, like phenols and alcohols, which are found in a lot of drugs and even some foods. It just slaps a different kind of shipping label on them, a sulfate group, to get them ready for disposal. And this is where things get really cool. We almost always think of phase 2 as turning things off, deactivating them. But with minoxidil, the active ingredient in Rogaine, sulfation does the exact opposite. It's the sulfation process that actually activates the drug and turns it into the form that helps with hair growth. So sometimes the cleanup crew is actually the turn it on crew. Pretty amazing, right?
Okay, next we have methylation, and this one is kind of the odd one out. Instead of making things more water-soluble, it can sometimes make them less so. So why would the body do that? Well, its main job isn't always about disposal. It's more about deactivation. By adding a tiny methyl group, the body can just flip the off switch on some really powerful things, like hormones, keeping them in check.
And last but not least, there's acetylation. This is another really important pathway, especially for drugs with a specific kind of chemical structure. Now, while it's a key part of the cleanup process, it's also famous for something else. It really shows just how different we all are from each other on a deep biochemical level.
And that, right there, brings us to probably the most important point of all. These cleanup systems are not one size fits all, not even close. They're built from our genetic code, which means your internal cleanup crew can work very differently from the person sitting next to you.
Thanks to little variations in our genes, people can be divided into groups. For acetylation, some of us are normal acetylators, and we process these drugs just fine. But a huge chunk of the population are slow acetylators. Their system just runs at a much slower pace. And this isn't just a quirky biological fact, it has major health implications.
This quote spells it out perfectly. If you're a slow acetylator and you take a normal dose of certain drugs, your body can't clear it fast enough. The drug hangs around way too long, builds up, and can cause some really toxic side effects. It's a perfect example of this genetic lottery and why personalized medicine is so important.
Okay, so let's zoom out for a second and bring it all home. We've talked about all these different pathways, from the workhorse glucuronidation to the individual quirks of acetylation. So what's the big takeaway here? Why does any of this actually matter?
Well, at the end of the day, phase 2 is our body's master protector. It takes these oily, potentially dangerous substances and transforms them into harmless, watery wastes that our kidneys can just flush right out. It's this silent, tireless shield that protects us every single day from all the chemicals we encounter.
And that leads us to a final, really exciting thought. Since we know that we all have these tiny differences in our metabolic machinery, like being a slow acetylator, it opens up this incredible door for the future. Are we heading towards a time where we can design drugs perfectly matched to your body's unique cleanup crew? Just imagine that. A prescription based not just on your symptoms, but on your own personal genetic blueprint. What a world that will be.